During pregnancy, some women develop high blood sugar levels. This condition is known as gestational diabetes mellitus, GDM. The definition applies whether insulin or only diet modification is used for treatment and whether or not the condition persists after pregnancy. Gestational diabetes generally results in few symptoms, however, it does increase the risk of preeclampsia, depression, and requiring a caesarean section. The pathophysiology. It starts when there is insulin resistance, where the body's cells fail to respond to the hormone insulin in the usual way. Then, several pregnancy hormones such as estrogen, progesterone, prolactin, cortisol, human placental lactogen, are thought to disrupt the usual action of insulin as it binds to its receptor. In the presence of insulin resistance, this uptake of blood glucose is prevented and the blood sugar level remains high. It can cause the glucose present in the blood then crosses the placenta via the GLUT1 carrier to reach the fetus. Then, the fetus is exposed to an excess of glucose, which leads to an increase in the amount of insulin produced by the fetus. The risk factor of GDM. Firstly, age more than 35 years old, have family history of diabetes mellitus. Next, have previous obstetric history such as previous delivery of infant with macrosomia, miscarriage 2 to 3 times onward, obese or excess body weight gain during pregnancy. The sign and symptoms of GDM. Firstly, weight loss. Have weight gain after morning sickness, season, polydipsia and polyphagia, have polyuria, delayed wound healing, dry and itchy skin, numbness and tingling at feet. The complication. For maternal, it will cause preeclampsia, infection, caesarean delivery, difficult labor, fetal macrosomia, lead to shoulder dystocia and pregnancy-induced hypertension, PIH. For fetal, it will lead to respiratory distress syndrome, cardiac and neural tube defect, macrosomia, hypoglycemia, polycythemia and hyperbilirubinemia. The investigations that must be performed: physical examination, random blood sugar, modified glucose tolerance test, MGTT, close monitoring of blood sugar profile, urine glucose test, glycated hemoglobin 1 AC, HB1 AC, kidney function test, urine culture.
Nursing management of gestational diabetes mellitus. Mellitus. There are several nursing management that we are going to talk, such as assessment of patient's condition, blood sugar level monitoring, diet control, insulin therapy, health education, fetal monitoring, exercise and management of infection. We will discuss it one by one. Firstly, as a nurse, we should do an assessment of patient's condition. We should assess the patient's history of GDM. We should identify it to prevent any complication during pregnancy. Assess physical condition by assessing the patient's blood pressure while sitting and standing to detect orthostatic changes, the body mass index and visual acuity, and performing examination of foot, skin, nervous system and mouth to detect any abnormalities such as edema. We should ensure that the laboratory examinations such as HbA1c, fasting blood glucose, lipid profile, microalbuminuria test, serum urea test, serum creatinine level, urinalysis, and ECG must be requested and performed. Next, the nursing management of GDM is blood sugar monitoring. Maternal blood sugar monitoring is performed regularly. We need to educate patient about self-monitoring of blood sugar level at home to control blood sugar level. For example, for first trimester, glycosylated hemoglobin, HbA1c, is performed every 3 months. An oral modified glucose tolerance test, MGTT, or blood sugar profile are done throughout the day for the third trimester. Thirdly, diet control must be emphasized. It is vital to keep blood sugar level is in normal range during pregnancy. Initially, a diet of 30 calories per kilogram body weight with 60 to 70% carbohydrate and fiber is introduced. Encourage pregnant women to take low sugar and carbohydrate content and take food high in fiber such as fruits and vegetable as indicated in Healthy Plate method. Next, consult the patient with a dietitian for further nutrition management. Next, administration of insulin therapy as prescribed by doctor. For patient who had oral medication that not function well to decrease the blood sugar level, need to shift to insulin therapy as prescribed by doctor. It is for ensure the control of blood sugar level and prevent any complication towards the fetus. In addition, it is easier to adjust insulin doses to maintain around-the-clock glucose control, than to adjust doses of oral diabetes medications, as insulin doses can be adjusted meal by meal as indicated. As a nurse, we should do health education towards our patient. Provide information about GDM, its complications, treatment and self-care management. Next, instruct pregnant mother to comply to attend with obstetrician, for monitor the progress of pregnancy and ensure maternal health and fetal development is in good condition. Encourage patient to do family planning in future because it can reduce the rate of mortality and morbidity during birth. Fetal assessment must be performed to identify fetal growth and the placenta's ability to provide oxygen and nutrients. It can be assessed via ultrasound examination. It can identify any abnormalities such as thalassemia, polyhydramnios in women with poorly controlled diabetes or oligohydramnios in placenta failure. Next, fetal heart rate can be monitored by stethoscope, movement estimation, Doppler and biophysical profile are done to detect fetal hypoxia. Fetal movement chart are done. Fetal movement chart is done during pregnancy. It is for assessing fetal well-being and growth development, especially in high-risk mother. It can reduce perinatal morbidity and mortality rate. It can be performed at 28 weeks of gestation. Educate patient to count the movement every day, preferably at the same time. Monitor fetus movement up to 10 times and record the time of complete 10-time fetus movement every day. Furthermore, exercise is important to keep maintaining blood sugar level in normal range. Encourage patient to do light exercise regularly during pregnancy, such as walking or yoga for at least 3 times a week. However, the strenuous exercise must be avoided because it may harm the fetus. They should be taught to count their heart rate and given a range that is healthy for them and their fetus. They should be taught to evaluate themselves for uterine contractions and to stop exercising immediately if occur. Next, management of infection is important towards pregnant women. We must educate patient about causes of infection occur such as bacterial, virus or parasites due to poor hygiene care. Describe the signs and symptoms of infection such as fever or flu. Explain the treatment of infection. We must advise patient to go to healthcare provider to get treatment. Advise patient to not buy over medicine to prevent any complication towards patient and fetus. Educate patient about the prevention of infection. Educate patient about perineal care by washing from front to back by using mild soap and water and keep clean and dry to prevent infection. Next, advise patient to choose suitable underwear such as cotton. Educate patient to avoid using panty liner and feminine hygiene because it may introduce infection. Encourage to clean perineal area and urinate before and after doing sexual intercourse. There are several nursing diagnoses of gestational diabetes mellitus. Firstly, imbalanced nutrition, less than body requirement related to inability to utilize nutrients appropriately. Next, risk for maternal injury related to changes in diabetic control. Besides, risk for fetal injury related to elevated maternal serum blood glucose level and deficit misinformation of gestational diabetes mellitus. That's all from us. Thank you for watching.